Hello and welcome to this recorded presentation for the employees of Q International School for the employee benefits year beginning September 1st, 2023. My name is Bill Hammett. I am happy to be your insurance expert on the team serving you, as well as Rhiannon and Anna. But all of us are available now and throughout the year to help you understand the plans, help you find the right one, find doctors. If you lose your ID card later in the year, if you need help with claims, whatever it may be, we're here to serve you all year long. A quick agenda, we'll talk about the timeline of open enrollment, the medical plans available. We'll talk a little bit about dental and vision. We'll have a quick tutorial on how do I enroll. And if you have any questions, if you need any answers, feel free to reach out to us. So open enrollment starts today, July 18th, and goes through July 26th. All right, that is our open enrollment period. So we're asking that everybody have everything done and completed by next Wednesday, July 26th. This is your opportunity. This is your once-a-year opportunity to enroll or decline benefits. You can add your dependents. You can waive your benefits. You can change from one plan to the next. If you didn't have dental last year, but you want to add it, now is your time. If you want to add a dependent that you didn't have before, now is your time to do so. So all of these changes are when you can make, this is the time of year where you can make all these changes. The effective date for any of these changes, if you're enrolling for the first time, if you're making changes, adding benefits, whatever it may be, that effective date would be September 1st. So even if you go in right away and do this, it doesn't take effect until September 1st. We're asking everybody to complete this no later than Wednesday, July 26th, and you'll complete your applications online on the Ease Benefit portal. So let's talk about our medical plans available through Kaiser Permanente. There is 5, so we have a bronze, 2 silvers, a gold, and a platinum. We'll get into the benefit details here in a minute, but basically bronze is going to be your lowest cost plan, but it's going to ask you to pay the most when you use your insurance, all the way down to platinum. This will cost you the most on a per paycheck basis, but if you need to use it, you will have the least amount of out-of-pocket expenses. So let's talk about our bronze and silver plans. So bronze and silver level plans are going to be really good for those of you that don't have a lot of medical needs, that just want a health insurance plan that is as low cost as you can possibly get it, and you're not going to be using it a whole lot. So you notice with this bronze plan here is a $6,300 deductible. That's a very large deductible. So if you find yourself in the hospital or needing surgery or emergency room, you're going to have to pay all $6,300 before the insurance company pays anything. And then we have our silver plans here to the right. So let's just look at this one right in the middle here, the Silver 70 2500. So both these silver plans are really good value plans, good for those of you that don't have a lot of medical needs, but you don't really want a plan with such a high deductible. Silver plans are perfect for you. So I'm going to kind of go through this plan, the Silver 2500 plan down the middle, go over a lot of the terms. This should hopefully help you understand how all these plans are laid out, what the terminology means, and how you can best decide what's best for you. So let's start with the top, a deductible. So this plan is a $2,500 deductible. What is a deductible? A deductible is, generally speaking, the amount that the insurance company says you must pay 100% before they start to pay anything. So when you have a deductible, you're basically out of pocket this whole amount before the insurance company starts to pay anything. The second number, out-of-pocket maximum, $87.50. This is the point in which the insurance company pays 100% of everything and you pay 0%. So no matter what happens to you in a given calendar year, the maximum out-of-pocket you should have is $8,750. So no matter what happens, that's the most you'd have out of pocket. As we slide down, we see office visits, $55 and $90. This first number is how much it costs to see a regular doctor. The second number is how much it costs to see a specialist. This DED waived notation you see here means that it waives the deductible. You do not have to pay the first $2,500 before you get this benefit. So whenever you see DED waived, this means that you get this benefit right away. You do not have to meet your $2,500 deductible. So if I were to enroll in this plan for the first time on September 1st and I needed to see a regular doctor, I would pay $55 to see that doctor. If I was referred to a specialist, I would pay just $90. All right. We'll talk about more when that deductible comes into play here shortly, but wherever you see DED waived, that's a good thing for you as the consumer because it means you do not need to pay that deductible first. You get the copay right off the bat. Next benefit is a diagnostic lab and x-ray. So diagnostic lab, this is blood work. X-ray, of course, is an x-ray. There's a copay of $55 for blood work, $90 for an x-ray, deductible waived. Again, you do not need to meet your deductible. Right below that, we have imaging. So this is complex imaging, CAT scan, PET scan, MRIs. Here you see after you meet your $2,500 deductible, then you would have just a $300 copay. All right. So if you needed to use this plan and you had not used it at all and you needed an MRI, you will pay 100% of that cost until on the year you've spent $2,500. Once you hit that $2,500 mark, then that only costs $300. Okay. So this $2,500 deductible is a rolling cumulative number. So let's say that you got an MRI and it was $500. You would pay all $500. But now you've met 500 of your 2,500. So you have only have $2,000 left of your deductible. Okay. Below that, we have rehabilitation and habilitation. This is physical therapy, occupational therapy, speech therapy, $55 deductible waived. Chiropractic is not covered on this plan. Here we have a pharmacy deductible for brand name drugs, tiers 2 through 4. This means that you will pay 100% of the cost for the first $370 for brand name drugs. All right. Kaiser really only has the two tiers, tier 1 and tier 2. This is generic and brand name drugs. So if you need a brand name drug on this plan, you're going to pay 100% of the cost until you hit $370. And once you hit that number, then you pay $85. This other number, 740, that basically is saying that there's two $370 deductibles per family. So if it's you and one other person, each of you would have a $370 deductible. If it's you and your spouse and 3 children, then one of you will meet that deductible in full at $370. Then the rest of you have the other $370 in brand name drugs. Really what this is telling you is try to find generic drugs if you can. Down here at the bottom, we start seeing percentages. All right. Inpatient hospital, 40% after deductible. Outpatient surgery, 35% after deductible. Emergency room, 30% after deductible. This is how that works. I'll tell you what it does not mean. It does not mean that if you have a $100,000 hospital stay that you're paying $40,000. It does not mean that. What it means is if you end up in the hospital, you're going to pay 100% of the cost until your deductible is met. After you meet your deductible, you pay 40% of the cost. Kaiser pays 60% of the cost until everything you've spent in that hospital stay, plus prescription drugs, plus physical therapy, plus MRIs, plus lab work, plus doctor visits, everything adds up to $8,750. At this number, $8,750, which includes our $2,500 deductible, once we hit $8,750 for the year, then you pay nothing else for all covered services for the rest of the calendar year. All right, this goes all the way through December 31st. Even though we're starting September 1st, your plan deductible and everything restarts on January 1st. So again, if I end up in the hospital, it's $100,000. I pay 100% of the cost for the first $2,500. Then I pay 40% of the cost of the remaining $97,500, 40% of that. Once I have spent another, so I've already spent $2,500, I now have to pay 40%. My 40%, once my 40% equals $6,250, so that's $2,500 plus $6,250 is $8,750. Once I've spent a total cumulative amount of $8,750 in any combination, whether it's one really expensive hospital stay or it's 100 MRIs or whatever, once I hit this number, I pay nothing else for the rest of the calendar year, and Kaiser pays 100% of the cost. All right. This out-of-pocket maximum, this is most of what you're paying for an insurance policy, which is the deal you're making with the insurance company saying, once I hit this number, that's it. I pay nothing else and you pay everything else. So same, all these percentages, same thing with the emergency room, 30%, and then urgent care is a $55 copay deductible waived. Now notice how we looked at all that. Notice how these compare with these other two plans. So with the bronze plan, that deductible is much higher. Out-of-pocket maximum is not that bad. Doctor visits, you only get 3 visits at this copay. After you use 3 visits, whether it's a regular doctor, a specialist, or an urgent care, once you use 3 visits, then you have to then pay 100% of the cost after that. So here we have unlimited doctor visits with these plans here. But with the bronze plan, you only get 3. Notice our pharmacy deductible is higher at $500. And then notice it for brand name drugs, you're going to be paying, what this means here is after you pay the first $500, then you're going to pay 40% of that cost not to exceed $5,500. So the way that would work is, let's say you have a prescription drug that's $1,000 a month. You would pay 400 of that, all right? Because 40% of 1,000 is 400. Let's say that prescription drug was $10,000 a month. 40% of 10,000, of course, is 4,000. Well, the way this benefit works is you pay 40% up to $500. So the most you would pay for a brand name drug is $500. So even if in a $10,000 prescription drug, you're only paying $5,000 a month. Now look at the Kaiser Silver plan. A little bit lower deductible, same out-of-pocket maximum. Our doctor visits are more expensive, but our x-ray and lab is lower. The big difference here is this prescription drug benefit. So for some of the really expensive drugs, you're going to have to pay the full $1,900 before you get anything. Otherwise, it's $20 and $100. And then, of course, we have our percentages here. So really, these two silver plans are very, very similar. It comes down to doctor visits and diagnostic lab and x-ray. Also, if you want one that covers chiropractic, here you'd see in this $1,900 one it is. So here's our gold and platinum plans. You'll notice much lower deductibles, a lower out-of-pocket. This platinum plan here has a $4,500 out-of-pocket. So for those of you that have a lot of medical expenses, I might point you towards this platinum plan. It's the best plan offered. You see the copays are lower across the board. Prescription drug, there's no pharmacy deductibles. But the big difference is down here at the expensive stuff. So hospital services, surgery, emergency room. Notice on this previous page, we had all percentages here. Now we've got flat dollars. So for this gold plan here, which I love, if you end up in the hospital, you'll be paying no more than $600 per day after you meet your $250 deductible for 5 days max. So this means that if you're in the hospital for 10 days, you'll pay $600 for day 1, $600 for day 2, $600 for day 3, $600 day 4, $600 day 5. And on day 6 and going forward, you don't pay any more copays for the hospital stay. Now, what's important to clarify is this $600 is basically the room and board. This gets you the room, it gets you the bed, it gets you all the nurses visiting you, it gets you all the equipment in there. But as soon as they start wheeling you out and doing MRIs and x-rays and a bunch of other things, that's where some of these other copays would come into play. Here we have our surgery benefit after your $250 deductible, which again, by the way, is only one time for the whole calendar year. So once you meet this, you don't have to meet that again. It's not like car insurance where every time you have an accident, there's a new deductible. So here, $600 a day, surgery, $335 copay, emergency room, $250, $35 for urgent care. Notice how on this platinum plan, it's $250 a day, $125 and $150. So platinum is going to be our best plans available. So just a little highlight of the Kaiser Permanente mobile app. If you want to improve your medical experience or your healthcare experience, download the smartphone app. When you have this on your phone, you have your ID card on you. You can look up your prescriptions. You can set appointments. You can message your doctors. You can find out what your lab results were. I mean, really, really, really good stuff in the palm of your hand. So please, please, please do that. Please download that smartphone app. Some extra added value benefits that are available through Kaiser. The Calm app, really, really great for mental health, great for meditation and mindfulness type exercises. This is a free program with your plan, so I encourage you guys to log in and use it. Also, there's the Class Pass with Kaiser Permanente. So you can access online classes on demand. You can even sign up and go in person to fitness classes And there's a 20% off a monthly package to do that as well. So really nice to have this class pass. Many of us have learned how to work out from home given the pandemic and what we all had to endure. So really nice to have this benefit available to you. So let's talk about dental. We have 3 dental HMO plans, the bronze, silver, and gold. HMO dental plans are going to be a very inexpensive way for you to get dental insurance. It's very inexpensive. You get your 2 free cleanings. The drawback of dental HMO plans is there is not as many dentists. And we have our PPO dental plan. We have our gold and our platinum, also through Delta. Dental PPO plans are a much larger choice of providers, but it's going to cost you more on a per paycheck basis. So a little bit better experience because the providers tend to be a little more happy to see because they get paid more with a PPO plan. One of the questions we get all the time is, can I decline to enroll in medical, but can I enroll in dental and vision? And the answer is yes. So you look at all of these different benefits as their own silos. So if you wanted to enroll just yourself in medical, but the whole family in dental and just you and your spouse on vision, you could do that. If you want to decline medical, enroll in dental for yourself and then vision for you and your spouse, you can do that. So think of them as all independent benefit plans to choose from. Speaking of vision, we have 2 vision plans. We have the gold and the platinum. Now these 2 plans are identical in every single way except for one. Both of them have the same exact network of vision providers through the VSP Choice Network. Both of them have a $10 copay for eye exams, and both of them have a $25 copay for lenses. The difference is in this frames allowance. So down here at the bottom, what I'm pointing out are these numbers. So the first 12 is how frequently we get our $10 eye exam. Same 12 months for both plans. The second number is how frequently we get our $25 copay for lenses, once every 12 months. This third number is where things get a little different. The gold plan makes you wait. You only get your frames allowance or your contact lens allowance. That's an or. Once every 2 years with the gold plan, but with the platinum plan, it's once every year. So this is why I love this platinum plan. Nothing wrong with the gold plan. The platinum plan gives you a $180 benefit once every 12 months versus once every 24 months. And this platinum plan costs about $23 per year more than the gold. So I'm not that good at math, but I do know that paying $23 of tax-free money in order to get a $180 allowance of tax-free benefit is a great deal. So if you need vision, I strongly suggest you go with that platinum plan. So let's talk about our enrollment. We're doing this online through the Ease Benefit Portal. You're going to get an email that looks just like this. It's going to invite you to enroll. It's going to have the subject line of Now Open Employee Benefit Enrollment Portal. There's your deadline. There's a link right at the very bottom. You can click. Here's my information as well as Jessica's information. We can help if you have any troubles. Once you land on that page, it'll look just like this. If you've been through this site before, you'll enter your username and password. If you haven't, it's going to ask you for either your date of birth or your social security number. Then you'll create a password, you'll accept the terms and conditions, and you'll log in. If you've forgotten your ID number, you can hit this forgot button here. Or if you're just totally stumped, if it's totally locked and you can't get in there, you can reach out to me right here at Bill at Hammett Health and be happy to help. So once you get in, you're going to go through the overview, the profile. This video that you're watching is embedded in the overview. You'll want to make sure you fill out your profile, add dependents. If you're not on Medicare, you skip through there. Once you get to your medical plans, it's important that you don't skip past this part. There's going to be a little check mark and an X. If this is your first time ever enrolling in the system or logging into the system, both of these will be gray. So you need to hit the check mark in order to be able to select a plan. And if you wish to decline, you hit the X and say no thank you. It's going to ask you why. It's mandatory to answer why. There's lots of different options as to why. You might not want it. All of them are valid, but it will ask you for one. You'll scroll down the page and you'll now see these different buttons that are lighting up. If you don't hit anything here, these select buttons don't exist at all. So it's important you hit this check mark here. Then you'll roll down and you'll hit the select button of whatever plan is best for you. Underneath, there's links to coverage. You can click these, open them up, and review. You'll notice on the right side, you're going to see your per paycheck amount. tallying up live. So as you switch between different plans, you can see these prices there. You'll do that for dental and vision as well. Once you're all done, you'll go to the benefit summary and you'll review how you enrolled. Employee only for medical, employee plus child for dental, employee plus child for vision. If that's incorrect, you can go back to this benefits button and fix it. Hit continue. Once you hit continue, this sign forms box is going to pop up. You're going to click the sign forms box. It's going to think for a minute, and then it turns into DocuSign, really. You're going to type your signature. Then you're going to use your mouse, or if you're on the phone or a tablet, you'll use your finger to sign. You'll hit next and next. And then it's going to roll you through the application where it's going to just ask you to put your signature in all the green boxes. So it's really, really fast. You just scroll through it and click right in the area. Once you're done, you'll hit the finish button at the very top right of the screen. And then once you do that, you'll get an email saying, thank you, your benefit elections have been submitted. That's when you know you're all done. You can close the screen. So what's next? You'll be getting an email very shortly inviting you to log in and enroll. We're asking everybody to have this done no later than Wednesday, July 26th. If you have any questions, if you need any answers, we're here for you now and in the future throughout the year. Call us, email us, whatever we can do to help you. Here's our information here, and that is the end of my presentation. Thank you all for the honor of being your benefits broker. We look forward to helping you. We are here to help, and we're honored to do so. So reach out to us if you need us. Thank you so much.